Distinguished guests, ladies and gentlemen, I'm delighted to join you all to mark this occasion, the 10th Obstetric Fistula Day. This day gives us an opportunity to reflect on the suffering of our girls and women caused by birth injuries that are preventable. Currently, only 61% of women receive skilled delivery, with the rest delivering at home. Most of the women who deliver under unskilled care are young, uneducated, and living in poverty. Therefore, these women are at risk of birth complications which could lead to obstetric fistula, which results from poor access to emergency obstetric care. Childbirth should be a time of joy and pride for every mother. However, women with fistula lose their dignity and go through stigma in the society. It is a grave injustice that the poorest, most vulnerable and marginalized women are the ones who suffer unnecessarily from a condition that has been eliminated in the industrialized world. Ladies and gentlemen, we must end this health and human rights tragedy. I urge the civil society and other organizations to prioritize advocacy for maternal and newborn health. I agree that significant strides have been made with regard to eliminating fistula globally and in Kenya. The government, for example, has intensified efforts to accelerate the availability and use of universally accessible quality health services, such as those related to maternal health, which are critical for reducing birth complications. However, much more remains to be done. County governments must strengthen their health systems with a view to attaining the Millennium Development Goals and national goals like Vision 2030. Maternal health is increasingly being recognized as a key indicator of health system effectiveness. Access to skilled birth attendants and family planning services are some of the known key interventions to prevent obstetric fistula. For this reason, I am committed and advocate and prioritize maternal and newborn health through the Beyond Zero campaign. I therefore call upon partners and healthcare workers in both public and private sectors and communities to work together towards universal access to reproductive health services. We are privileged to have diligent partners supporting the national program, and I would like to especially acknowledge the Kenyatta National Hospital, which supports capacity building of health workers, community mobilization, provision of hospital equipment, funding fistula repair and rehabilitation of fistula survivors. We also recognize other partners, some of whom are here, like the Flying Doctors and the Freedom from Fistula Foundation. The management of obstetric fistula has been largely facilitated by the development partners because the clients are too poor to afford payment. The comprehensive support ranges from transport to access to repair services, hospital fees, capacity building, social rehabilitation of the survivors, and initiation of income-generating activities. Recognizing that many of our would-be mothers cannot access maternal health services due to financial constraints, His Excellency the President gave a directive on the provision of free maternal health services in all public health facilities. Increased access to skilled delivery will serve to prevent the occurrence of obstructed labor that commonly leads to the development of fistula. Ladies and gentlemen, the solution is simple and clear. Improving access to reproductive health services is critical. Although the campaign to end fistula has enhanced the visibility and knowledge of fistula worldwide, it is still under-resourced and requires far more financial and human resources to achieve its goal of eliminating fistula entirely. The Ministry of Health has guidelines and training curriculum to strengthen the local capacity in our health facilities. The power to eliminate obstetric fistula lies in our hands. We must continue to build partnerships and mobilize our health system and communities to garner the necessary resources and support required to end the shame, end the isolation, and end fistula. We owe it to our women. We must do it together. It is now my pleasure to officially launch the 10th National Fistula Medical Camp. I thank you.